Hello everyone, good evening. I'm Shreya Dhondia. In the last 24 hours, some more details have emerged on the Omicron variant from South Africa. First, the virus is spreading rapidly across the globe. In 3.5 weeks, South Africa has gone from reporting 300 positive cases per day in mid-November to 11,000 cases per day now. Secondly, as compared to Delta, Omicron is 3 times more likely to cause reinfections. The finding is based on data that has been collected by South Africa's health system, and it gives us the first epidemiological evidence about Omicron's ability to evade immunity from a prior infection. Can it beat vaccine-induced immunity? That is what the trend is pointing to, but there is so far no data to establish it. Also, South Africa's health ministry says they are seeing increased hospitalization in kids under the age of 5. Now, it is important to look at South Africa's experience to know how Omicron will behave in India. So we are speaking to Professor Teresa Russo, who is a professor at the Department of Immunology at the University of Pretoria, the epicenter of the Omicron variant. She's treating patients there, so we are asking her about her experience. Before that, though, hear from South Africa's health ministry on what is clearly a worrying trend. Children under the age of 5 being hospitalized more than ever before for COVID.
We've always seen children not being very heavily affected by the COVID epidemic in the past, not having many admissions. In the third wave, we saw more admissions in young children under 5 and in teenagers 15 to 19. And now at the start of this fourth wave, we're seeing quite a sharp increase across all age groups, but particularly in the under 5s.
Now, the first confirmed infection of Omicron was reported in Botswana around 11th of November. Since then, it has spread to over 30 countries. The maximum cases are in South Africa, and the numbers, as you've seen, are only growing, galloping actually. Europe fears that in the coming months, half of its COVID cases could be driven by the Omicron virus. Will Omicron drive India's third wave as well? We'll just have to wait and watch for that. For the moment, the world has gone into high alert mode. Germany has proceeded to ban the unvaccinated from public gatherings, while relock measures are kicking in across the globe. Take a look.
The Omicron variant now makes up 3/4 of positive tests in South Africa's Gauteng province. The country is facing a new wave of coronavirus infections. And a top South African researcher said Thursday that it may be fueled in part by a unique characteristic about Omicron.
We monitor these reinfections for the Beta and for the Delta wave, and we didn't see an increase in reinfections over and above what we expect when the force of infection changes, when the wave stops. However, we are seeing an increase for Omicron. Previous infection used to protect against Delta, and now with Omicron, it doesn't seem to be the case.
All preliminary evidence points to relatively mild symptoms with Omicron.
Dr. Anthony Fauci, director of the
and scientists are still hopeful that the current vaccines will prevent severe disease.
We know from our experience with Delta that even though the vaccine is not directed specifically at Delta, it's directed against the ancestral strain, the Wuhan strain. Yet when you get your levels of antibody high enough, you protect against Delta. That's where we're hoping we'll see with the Omicron variant.
With or without Omicron, the pandemic rages on. Here in Germany, hospitalizations are rising, and the government is banning unvaccinated people from accessing all but most essential businesses. Both Angela Merkel and her designated successor, Olaf Scholz, who is set to take over next week, say they back the idea of mandatory vaccinations.
We will reserve access to cultural and recreational facilities and events throughout Germany, regardless of the incidence, only to those who have been vaccinated and cured.
South Korea has found just a handful of Omicron cases among travelers from Africa, but is reporting a record number of new coronavirus infections for the second straight day. Omicron has proven once again that no one is safe until we're all safe, and the WHO is urging African governments to step up their vaccination efforts.
Africa has made little inroads in the path to providing vaccine protection. So far,
only 102 million African in Africa, or 7.5% of the continent population is fully vaccinated. More than 80% of the population has not received even a single dose.
Vaccination centers like this one in Nigeria as critical as ever in the global efforts to end the coronavirus pandemic.
I'm going straight across to Professor Teresa Russo, who's a professor at Department of Immunology at the University of Pretoria in South Africa, which really is the epicenter of the Omicron variant. Professor, thank you very much. Firstly, I want to understand from you the trajectory of Omicron in South Africa since you're treating patients. Initially, we were told the illness is mild. Does it continue to be mild? And is Omicron infecting people who are vaccinated or who aren't vaccinated?
Yes, so we've certainly seen a dramatic increase in cases over the last week or two. It started as drips and drabs, but suddenly our testing rate has gone up dramatically. So we have about 30 to 40% of people who are testing positive at the moment. So just yesterday we had 11,000 new cases, and that's come up from really about 100 cases per day to 11,000 per day. So there's been a dramatic increase. The good news is that the infection is mild. We have not really seen a dramatic increase in death. So there has not been a proportional increase in death. We only had 44 deaths in the last day. So from what we know now, and it's still early, it does seem to be milder. It may change over the next few weeks as the infection spread to more vulnerable populations. But so far, even for people in hospital, they don't seem to require a lot of oxygen or ventilation. The one worrisome thing is that we are seeing it also in people who have been vaccinated, but mild disease. Once again, I have not seen many people who were hospitalized if they had been vaccinated before.
Doctor, can I ask you, what is the percentage of people who are coming in with COVID with the Omicron strain, which is dominating 75% of all cases in South Africa? What is the number that actually requires hospitalization? And when you say you have to wait and watch how the variant behaves in the vulnerable population, am I to assume that even now it is only affecting the younger lot and not the older lot?
Yes, you're quite right. We've seen it mostly in young people. So there have been little outbreaks in schools and also in teenagers. And I think it's good to remember that we have not vaccinated the young people yet. We only recently opened vaccination for people from the age of 12 and up. So the majority of them have not yet been vaccinated. So as it spreads, it will go into the older population, but we've certainly not seen that yet. It's difficult to estimate the proportion that need hospitalization at the moment, because we know that testing is probably underestimating the number of people who are infected. The symptoms seem to be slightly differently. People are presenting with a sinusitis type of picture. So a lot of people just think they have hay fever. So it's not the classic loss of taste and smell that we are seeing. So I think a lot of people are not diagnosed with COVID at the moment. But it's really a small proportion that end up in hospital. From what I saw in the academic wards this morning in the academic hospital, most of the patients actually had something else that brought them to hospital. And then they tested positive for COVID as well. So being admitted with COVID as the main cause is really very limited still at the moment.
But there are some worrying reports, and correct me if I'm wrong, that are coming out of South Africa itself that seem to suggest that children below the age of 5 are requiring hospitalization more than ever before.
Yes, that is worrisome. Up to now, we've really not seen that children were severely affected, especially the younger ones, unless they had other comorbid diseases. So our children with cancer, with maybe renal failure, those kind of kids were the ones that were admitted and did badly when they had COVID. At the moment, we have seen a sharp increase in cases in children. Deaths, as I say, have not really increased, but there are more children that need to be in hospital for COVID than we've seen before. I'm afraid time will tell, what the reason for that is. It may be that because of vaccination, we're driving it into the younger population. And of course, we will have children that don't have adequate immunity yet, especially the ones that are under 1 year of age. They seem to be the most vulnerable to having a poor outcome.
Doctor, I know South Africa itself is only just grappling with Omicron. The experience is barely 3 weeks old. In India, we have detected our first 2 cases of Omicron. That will only grow. So as a doctor who is treating people in South Africa and in the epicenter of the Omicron virus, could you tell people here in India who are watching and doctors who are watching as well what we are in for?
Well, we don't have the laboratory data yet. So as you say, we are just starting to understand the variant. But from what I can see, it does seem to be more transmissible. It does seem to spread from people a little bit easier than the previous variants. But as I say, this has not been confirmed yet in the laboratory studies. So we're still waiting for those results to come out. What I would really recommend is that people get vaccinated if they're not already vaccinated, that they don't lax on the public health prevention strategies that we have, like wearing masks. I think that in some extent did contribute to the spread of cases here because people are getting into a holiday mode, towards the end of the year, they're tired of wearing masks. I would really urge people, don't forget your public health measures. So wash your hands, keep a physical distance, wear your mask. And that is at this stage, I think, the best we can do. It is encouraging that people who have been vaccinated do not seem to be as ill as the ones who have not been vaccinated. So I really urge people, go for vaccinations, whatever one you can get, that will give you protection. So that would be my message at this stage.
Doctors, there are reports that are coming out of South Africa itself that are saying that Omicron is 3 times more likely than the Delta variant to cause reinfections. Is that something that is bearing out in hospitals as well?
We are definitely seeing that people who have been vaccinated are getting infections. We've seen people in hospital who have been vaccinated, but once again, they don't seem to be as ill. So I would agree with that. We've seen people who had COVID in previous waves, whether with the Alpha or the Beta or the Delta variant, becoming ill with COVID again this time, but once again with milder disease. So I would agree with that, that early suggestion that it is probably more likely to cause breakthrough infection.
Okay. Doctor, as far as the line of treatment is concerned, are the medicines / the line of treatment that you are using to treat the Delta variant, is that working for Omicron as well?
We have not had any need to change protocols yet. So everything we've been doing thus far seems to be working. But very few people actually need oxygen. So at the moment, we still, hopefully it will stay like this. I hope it's not going to get worse. But we have seen that people are able to get, to recover with just routine treatment, not with ventilation or any specialized treatment. So that is quite encouraging.
My last question to you, doctor, since you've been seeing patients for the last 3 weeks infected with the Omicron variant, what are the symptoms that all of us need to watch out for?
That's right. It seems to be different. So people are generally presenting with sore throat, headache, sometimes a stuffy nose, some people with earache. So more an upper respiratory tract-like infection. So I would really encourage people, even if they think it is just a cold, just to go for testing to know, because it is so easy to transmit it to somebody else.
All right, doctor.
Don't wait for things like, loss of taste. Or loss of smell, because that does not seem to feature very prominently with this variant.
Doctor, I'm going to thank you very much for your time here on CNN News 18. Half of North India is down with a cold and a flu. Not to spread panic, but if you have the flu or the cold, Possibly could be something more than that, so just keep a check on your symptoms. Now, in the face of Omicron, the question is, are Indians better protected, given that 60% of us have immunity, according to the Sero survey, and 49% of us are fully vaccinated? Also the question, to boost or not to boost. In India, the moral dilemma is this: should you fully vaccinate every adult first, or give boosters to healthcare workers and the vulnerable population who had got their second shot 6 to 7 months ago and now their immunity is waning a bit? The health minister is saying a decision on boosters and getting kids vaccinated will be based on science and priority, not politics. Take a look. In the war against a Hydra-like virus with multiple heads cropping up in the form of variants, do your antibodies need a boost? The US president certainly thinks so.
Do not wait. Go get your booster.
The vaccine makers believe it too.
In both cases, boosters should reduce dramatically the gap.
And now even the world's foremost health expert has given the nod.
Should I wait to get that boost? And the answer is no. If you are eligible, namely if you've had the Moderna or the Pfizer and you're 6 months following your primary regimen of vaccination or you're 2 months following J&J, don't wait. Get that extra boost now.
With Omicron now in India and predicted to be at least 3 times more likely to cause reinfections compared to Delta, the focus is back on the booster debate more than ever before. The Serum Institute of India, which produces the vaccine given to 90% of all Indians, has already sought approval for Covishield as a booster dose, citing adequate stock availability in the country. The opposition has asked the government questions in Parliament.
बहुत से हमारे वृद्ध, हमारे दादा दादी, नाना नानी हैं जिन्होंने 2 डोज ले लिए हैं, पर उनको और हम अधिक संरक्षण देना चाहते हैं, उसको हम बूस्टर डोज देना चाहते हैं. कहां है आपकी बूस्टर डोज पे पॉलिसी?
But experts in India believe that the booster dose isn't the solution for all our concerns, given that more than half the country is still to be vaccinated.
What we should be really debating is, have we vaccinated enough number of people? There is a huge number of people who had 1 dose of vaccine. They haven't taken the second dose. So everyone who had the first dose should run and get their vaccine. And then at some point of time when that is covered, government will be very comfortable in opening it up for the booster dose.
Which is why India's policy as of now remains wait and watch.
जैसे जैसे साइंटिफिक फैक्ट्स और डेटा इंफॉर्मेशन अंडरपिनिंग्स ऑफ दिस वायरस वेरिएंट समझ आएंगी, वो उस काम पे लगेंगे. बट आवर वैक्सीन एंटरप्राइज एंड मैन्युफैक्चरर्स आर वेरी अलर्ट टू ऑल दिस इश्यूज एज दे इमर्ज.
बूस्टर डोज के संदर्भ में हमारे एक्सपर्ट टीम ही तय करेगी और जो भी मार्गदर्शन हमारे एक्सपर्ट और साइंटिफिक हमें मार्गदर्शन मिलेगा, इस साइंटिफिक मार्गदर्शन के आधार पर हम आगे चलेंगे.
To boost or not to boost. The government continues to deliberate, but the fear remains that Omicron won't leave us with much of a choice. With Ritanshu Bhattacharya, in New Delhi, I'm Shreya Dhondia. And Omicron has put a dampener on recovery as well. The travel industry, just about getting into party mood with the year end right around the corner, is slipping back into depression. We have a special report on that. Do stay with us. As Omicron marches across the globe, it has managed to slow down travel plans. 56 countries have implemented travel measures. In India, it has resulted in absolute chaos at airports. So should we all be bidding goodbye to travel for the foreseeable future? Not necessarily. Take a look.
Long queues, irate passengers, and ironically COVID norms gone for a toss in big crowds. What was meant to be a much needed foreign vacation for these passengers became an unending nightmare, thanks to stringent flying norms brought in over the Omicron variant.
The Delhi airport coming in was normal as far as landing, but going through the testing was a disaster.
There is a negligence, there is a gap in the system, what they are doing right now.
I appreciate government whatever they did, but the people they are taking the test, they are not doing it properly.
The horror stories from airports in the past few days have forced many to rethink their year-end vacation plans. Some are advancing their plans before the situation gets worse. Others are indefinitely putting their plans on hold. For instance, 38-year-old Mumbai-based entrepreneur Prera Kadakia was scheduled to take his first business trip in 2 years after the COVID pandemic. But his plans are all up in the air.
I'm planning to go on Saturday to Belgium, but apparently India has put Europe at the list of the risk countries. So now the thing is, we are not sure if when we come back, what are the restrictions and stuff. They have announced them, but we don't know if we are there and if there is a stricter action that comes up by the government, then we are stuck there. But the thing is, for our business, it's very important for us to travel.
Meanwhile, travel companies which have ensured a safe travel arrangement for clients during the peak of the pandemic are not yet in a mood to press the panic button and derail its revival.
We are advising our customers to not change their travel plans or do anything till we have another week or 10 days, till we have information available which comes in to us from the authorities.
But there's no denying the impact on bookings and subsequent cancellations.
Say we have seen some moderate impact, not very significant, but I would say about a 10 to 15% drop from the run rate which we were having before this latest scare, hit the market.
For an industry perhaps worst hit by the pandemic, the panic over Omicron comes at the worst possible time, just when they were looking at the holiday season to provide some much needed cheer.
What is notable is the bounce back, from both the waves. And I think that is what gives us the encouragement that, now with every passing day, there are going to be temporary speed bumps.
Nobody wants to be spending New Year's Eve stuck at a crowded airport for hours waiting for a negative test. So yes, it's better to usher in the new year from the safety of our homes than in the hospital. With inputs from Mihir and Ridhima, Ritangshu Bhattacharya for CNN News 18.
15th of December is when India was to open up international travel. That plan is on hold because of Omicron. The uncertainty over the resumption of flights is coming at a time when hotels and airlines were hoping for a pickup in business during Christmas and New Year's. Before the pandemic, which means 20 months ago, the busy holiday season, which is right now, accounted for more than 60% of the $30 billion that India earned annually from foreign travelers who were visiting the country. India's tourism accounts for around 9% of the country's GDP, and the sector is one of the largest employers. So Omicron has had a major impact there as well. Omicron is a story we continue to track very closely here on CNN News 18. All updates, all details coming from South Africa being reported right here. It's a wrap from me. Thanks for watching. Good night.